society will be, but I've got viewers asking me these questions. Viewers are saying, all right, we can stay, we can afford to stay for 12 hours, 14 hours, and we will obviously launch the COVID warriors. But are we going to be expected to stay like this for a few more weeks? Is when the Prime Minister says a few weeks, is this a trial run? What is this going to be? Dr. P. Raghuram, let me ask you this. What is the sense that you get before I go across to Komal Nata and Varun Khera? Yes.
Thank you very much for having me on your show. First of all, the Prime Minister's message, as always, is crystal clear. He has addressed every segment of the society. He started off by saying that the problem is immense, and he expressed very clearly about the gravity of the situation. He then straight away went on to the fact that he emphasized social distancing and why it is so important. And clearly, as a doctor, it is so inspiring that he has paid rich tributes to the medical fraternity who have been working very hard, and he in fact exhorted the people on this Sunday evening to appreciate what they have done at 5 o'clock. And equally, this morning I had tweeted him with a request to send a message that all elective surgeries and non-urgent outpatient appointments must be deferred, and this message must go through. And this is a request that I had made in a tweet and also sent a message to the PMO. And I'm so glad that this has found place in his address to the nation.
Yes, it is.
He has very clearly spoken and prepared the nation for a longer period of perhaps a lockdown. And that is a test this Sunday, where this Janata curfew will be the first test for people to stay indoors. That is a very important component of social distancing. He has even addressed the elders, advising them on more than one occasion not to leave home, and emphasized that if we have to contain the transmission and spread of this unwelcome visitor in our lives, it's very important to have the social distancing.
True. And Sandeja, I'm just going to quickly circle back.
I know. My compliments to you.
We've opened up a control room here. We've opened up a control room. Every half an hour between 9 a.m. and 9 p.m. we are asking experts like you to come here and take viewer calls. And I'm sure you've been part of our broadcast. Leading luminaries from the medical fraternity we've been invited. And Dr. Raghuram, if you have the time to go through the course of the next 2 or 3 days, I invite you also to please join us on that broadcast, where you will be answering queries of our viewers around COVID-19. But let me ask you this, Dr. Raghuram. How do we control and what do we tell those people, some of them I quote unquote call them privileged jokers, who believe that they can just walk around thinking that it's all right, despite knowing fully well they should be in quarantine and they should be in isolation, especially those who have come from abroad, who refuse to be tested, who are creating ruckuses at airport, who are refusing to be hospitalized or go into isolation despite being advised to do so. How do we curtail those people? What do we tell those people to say, wake up, you're doing this for your country, don't be selfish here?
Absolutely. Taking responsibility for your actions is very important. And people who come from abroad as well, including foreign nationals, behaving this way is despicable. And we have to convey the strong message that unless we are united on this issue, we will lose this war against corona. The first case was detected in India on the 30th of January, and it has been close to 50 days now. The first spike we saw, first case that we detected in our country was on the 30th of January in Kerala. And since then, the first spike came on the 4th of March, and then subsequently on the 10th of March, and then today we have close to 200 positive cases. And we have tested close to 12,000 people. So are we doing enough? And the answer is clearly a no. Although the ICMR has reassured by saying that they have taken about 1,000 samples, random samples from the ICU, from patients who have pneumonia with acute respiratory distress, and they've all turned out to be negative, which is quite reassuring. But we clearly need to do a lot more. A country like South Korea has done thousands upon thousands, more than 250,000 people have been tested. So we clearly need to test far more number of people to know exactly where we stand. And in terms of what the nation should be doing, controlling a disease is a concurrent subject in our constitution. So the central government has as much say as the state government. So it's not just the political will, which has been very amply demonstrated by our Prime Minister, that he has the will to take the leadership on this issue. But equally, it's important to involve all the states. If you see today, only about 6 states are clearly implementing. I'm from Telangana, and this government has taken very proactive steps to close down all the malls, the shopping centers, the pubs, and various places. So,
Dr. Raghu, I have limited time, sir.
Seriously across. Yeah.
Sorry, I'm interrupting you because I want your inputs on something very critical, sir. One aspect is Donald Trump yesterday said that America is trying to figure out a way where people can test at home, because the testing mechanism, they are trying to innovate something. Why can't we urge our Jugadu gang, our innovative lot in our country, along with the help of the medical fraternity and the experts, to figure out a way where India can test at home? Cheap, very, very smart, effective way of this, the nasal testing of our lungs to see if we are infected or not. If we can figure out an effective a way to do this at home, and if we can make that mass public, then we can easily overcome the limitations of testing labs, limitations of samples, etc. Is that possible for us? Can we take that up as a challenge in our country? I'm exhorting viewers to try and reach out to all the innovative gangs to get down to it and do it even before the Americans do it, and let them do it there. Let's do it in India.
Absolutely. As the Prime Minister has already said, Make in India campaign must be, actually shown in this issue as well. But I would like to say that we have limited number of testing facilities in our country, and we are a population of 1.3 billion. So it should not be a panic mode for everyone. If someone is unwell, if you have sore throat, if you have fever, it's first of all important to self-isolate yourself, and only if you get worse should you call the COVID helpline. If everyone turns up to the hospital to get themselves tested, then we will be challenging the already limited resources. And the other point I'd like to say is that the level of preparedness must significantly increase. We must buttress the institutional response, because as of today we have less than 1 bed per 1,000 population, which compares to about 3 per 1,000 in China. So we need to increase our bed strength, and the ICU facility, which is actually very critical in this case. We have just 70,000 ICU facilities, which is far less. Should there be a crisis and a disaster, we are still not prepared, and we have a very fragile public health system. So measures must be taken to strengthen our public health.
Well, sir, I'm way over time, sir. I'm way over time, sir. We're going to take this newscast forward. Just if we have the time, I just would quickly like to tell our viewers. Prime Minister Narendra Modi has said, "Hum swasth to jag swasth." He said that let's come across and impose this self-imposed curfew, this Janta curfew on us on Sunday to test our patience and our resolve. Let's try and pass that test with flying colors. Let's show the world what India can do. Thank you very much. We're going to move.